would start with the people who we want to serve.
It's all about trying to localize as much as possible.
So organizations need to see the value in having prepositioned stock in our regions near to where the goods are required.
If we could remove all constraints, I think we would really change the paradigm around health, which means how do we let communities lead the way in saying, this is how I want to access my health services, and then all the systems would follow. You know, the information you might have, you know, that this sounds like a futuristic movie, but drones that deliver products to people when they need it, where they need it. You know, you would remove constraints around some of the marginalized communities we have, and them not having the agency to identify what their health needs are. And instead, right now, we have other people saying to them, this is the health we think you need, rather than them saying, no, this is the health outcome I need.
For our country to see health as business, now they don't see it as business. They see it as something we need to do because it is good to do to help. No, it is a critical business model that we can apply with local manufacturers and governments becoming the drug distribution centers. Then we begin to see our economy at least add to the socio-economic impact of the country.
Standardization of commodities. This will allow our local manufacturing base, our local suppliers, to be able to enter into the market. And then we are then able to improve or to advise on global standards on what they need to improve, what they need to do. So we are bringing sourcing to near to ourselves.
I think for me it's really important that we work with and for local people. So it's all about trying to localize as much as possible.
The softer side of our business, soft skills, work culture. In addition to having enough money to buy all the health products, in addition to having all this trained staff who will work miracles for us, we need to address the softer side.
Government, entities, etc., they need to focus on local production. They need to focus on building their local capacity. You might invest a little bit more, but this is more sustainable. For me, this is the first and immediate action.
I think in an ideal world, it would be the Ministry of Health being able to respond, by themselves, having that resilience, having those suppliers, local suppliers, available readily at the quality that's required to meet the needs of the beneficiaries. We're not there yet, but I hope we will be soon.